All right. Well, I think we'll get started. So hello, everyone, and welcome to this presentation on forging pathways, discussing the relationship between substance use and disabilities. My name is Aisha Hashmi, and I am a graduate assistant working with the Impact West Virginia project at the Center for Excellence in Disabilities. Also presenting with me today are Sue Workman and Dr. Lesley Cottrell, who I will invite to introduce themselves at this time.
Thank you, Aisha. I'm Sue Workman, and I am the program manager for Impact West Virginia. And Dr. Lesley Cottrell is the PI for our project, Impact West Virginia, and also the director for the CED. And we're happy to join you today to talk about this relationship between the two.
All right. Thank you, Sue. We will begin this presentation with a polling question. So our presentation is about the relationship between substance use and disabilities. And in the chat, I would like for you to just take a minute or two to let us know your thoughts about, can substance use and disabilities be related? All right. So I see that a lot of people are saying yes. So thank you for your responses. In this presentation, we hope to examine the relationship between substance use and disabilities, and also discuss potential comorbidities as well. We will also identify how substance use can be categorized as a disability, and also share waiver information later on. So how are substance use and disabilities related? It has been found that individuals with disabilities are at a higher risk of having a substance use disorder. Long-term substance use disorder creates an increased risk for an individual having a disability as well, which could result from injuries and other increased health issues. A lot of providers use the term comorbidity, and comorbidity means that there is a presence of more than one disease or condition within a person at the same time. And the comorbidity between substance use and disabilities is something that impacts individuals and families all over the country due to the complex relationship that exists between the two. Here, I'm going to share some statistics. According to the United States Department of Health and Human Services Office on Disability, 4.7 million adults in the United States have both a substance use disorder and a disability. In the United States, almost 16 in every 100 people with a disability also abuse some kind of substance. Other research has found that an estimated 1 in 7 individuals who are deaf have a substance use disorder, compared to 1 in every 10 hearing individuals. Our goal in this presentation is to start a conversation about the relationship between substances and disabilities in an effort to inform and bring attention to an issue that impacts individuals and families, not just in rural states like West Virginia, but all across the United States. The graphic below shows that about 2.6% of those with an intellectual disability may also have a substance use disorder. When looking at both substance use and disabilities together, it is important to identify certain common issues that might be present. For example, access to treatment can be restricted, and choices for available treatment options that can help treat both substance use disorders and disabilities may also be very limited. In rural areas, especially, the amount of available trained providers can be very low. Financial issues and stigma surrounding treatment can also be limiting factors that influence whether or not someone receives treatment, as well as long-term or generational substance use. So, how can substance use lead to a disability? With substance use can come consequences such as the increased risk of becoming injured while under the influence of drugs or alcohol, which may result in a traumatic injury or a physical disability. Addiction can also contribute to developmental disabilities, especially if a mother uses substances while pregnant. Substance use can also exacerbate many mental health issues and thinking disorders, and it can also make it more difficult for individuals to cope with physical disabilities as well. So, are substance use disorders considered disabilities? According to the U.S. Department of Health and Human Services Office for Civil Rights, drug addiction, including addiction to opioids, is considered a disability under Section 504 of the Rehabilitation Act, the Americans with Disabilities Act, and Section 1557 of the Affordable Care Act when drug addiction substantially limits a major life activity. The link for more information will be included in the slide deck and also can be shared in the chat. The Social Security Code of Federal Regulations shares how drug addiction or alcoholism is determined to contribute to an individual's disability. In general, they state that if there is evidence of an individual's drug addiction or alcoholism, in order to receive benefits, it must be determined if the addiction or alcoholism is a contributing factor to the determination of a disability, unless the individual is eligible for benefits based on age or blindness. They also go on to share the process that they follow once an individual has provided medical evidence of drug addiction or alcoholism. And I will point out that the key factor they will examine in the determination of whether the drug addiction or alcoholism is a contributing factor to the determination of disability is whether they would find the individual to be disabled if they were to stop using drugs or alcohol. To help make this determination, the individual's physical and mental limitations will need to be assessed in order to determine whether or not an individual has a disability resulting from drug addiction or alcoholism. When talking about disability determination, the Social Security Administration uses medical and non-medical factors to determine eligibility of benefits. And there are two types of disability programs: the Social Security Disability Insurance, which SSDI, and the Supplemental Security Income, SSI. And on this slide, we have provided some information on how to begin the application process. Federal disability rights laws also protect individuals if they have successfully completed a supervised drug rehabilitation program or have otherwise been successfully rehabilitated and are not currently engaged in illegal substance use, or are participating in a supervised drug rehabilitation program and are currently not engaged in the illegal use of substances, or are erroneously regarded as engaging in such use, but not engaging in such use. So,
oh,
go ahead, go ahead.
So I just wanted to balance what Aisha was saying from the other direction, because like many things, it's a very complicated and can be complex process. So on the other side, other direction, you can have individuals with disabilities who are also at risk for substance use. And what you can see on this slide is perhaps the most common factor there is that these individuals are often prescribed medications that, and many times that are addictive by nature. And so by taking medications for their condition, their medical needs, they can develop addiction to those medications. So you do see high rates of substance use, particularly prescription medication use among individuals with disabilities. Now, that's not always the case. And of course, it's very different in particular with particular conditions. But we did also want to mention that. And so some of the items and situations that are most common in the literature with regards to substance use among individuals with disabilities are listed on the right. Of course, then anytime we talk about comorbidity, as Aisha said, we see higher risk for other things. Again, individuals with disabilities also have higher risk for depression, anxiety, you see related to societal responses, lack of supports, perhaps other physical or sexual abuse that they're going through, or other trauma that they've had. And so we did want to mention that. Before I hand it back over, I did also want to mention that individuals with disabilities, again, depending on their condition, sometimes are often perceived as using substances when they're not. And so as providers, it is often helpful for us to work with them to navigate what to do in those circumstances. From their point of view, they may not be thinking about how other perceives or have the opportunity to clearly describe what's going on. And I know we have other sessions during the conference that speak to this, the reducing risk in those particular situations, but we also want to mention that sometimes individuals with disabilities are at risk for that when there's no substance use happening. So I'll turn it back over to you, Aisha.
Thank you. So as Dr. Cottrell mentioned, one type of medication that is commonly prescribed to individuals with disabilities is opioids. And opioids can provide pain relief by blocking pain signals from the spinal cord to the brain by releasing endorphins, which are the body's feel-good neurotransmitters. Opioids are meant to treat strong pain like chronic pains or pain after surgery. Another common substance is alcohol that can also be used by individuals who have a disability to help cope with difficult emotions or feelings that can arise. One of the reasons alcohol is so common is because it is a legal substance and can be easily found in most grocery stores or convenience stores. It's important to address barriers that individuals may encounter while receiving treatment for mental health issues and substance use disorders. Barriers that individuals may experience can be social, environmental, economic, psychological, or can relate to treatment facilities. Within facilities, there can be accessibility issues, such as inaccessible parking spaces, entrances, and interior spaces. There could also be policies in place that exclude individuals with disabilities, such as not providing support or assistance in the event of an emergency facility evacuation. Another barrier could be therapy models or interventions that are not adapted for people with cognitive disabilities, or also not having materials in Braille or other formats, like having larger print or electronic materials. And also, I think one of the biggest barriers is a lack of adequate staff training sometimes in technologies, technologies that are used for communicating with people who are deaf. So what are the consequences of all of this? Individuals with disabilities, even those who may not have a substance use disorder, are more likely to face unemployment. And without having a job or financial support, it can be incredibly difficult to find adequate health care. And not being able to find health care can prevent individuals from being able to enter treatment programs and even seeing doctors who could help them in their treatment or in recovery.
Thank you, Aisha. So the next slides, we're going to talk about a little bit more the connection of impact to this topic. And so we're going to talk about what is the connection between substance use during pregnancy and disabilities. So the substance use during pregnancies can result in a child's prenatal exposure to substances, which can lead to adverse effects on a child's development. These effects can result in mental illness, disability, developmental delays as the child grows, and at times they've even seen that this may result in substance use later in life. So Impact West Virginia uses a two-generational approach to try to compact this generational substance use issue and improve the quality of services to help reduce these health disparities of children impacted by the substance use. Our patient navigator model coordinates programs and services that addresses these barriers to care, such as poverty, geographic isolation, and anything like this that may particularly impact a child's health and future development. Our program is housed in the WVU CED, which does support a more diverse and inclusive communities. We also offer expert training, and we have a link to our website here on the slide. And we will discuss the expert training a little bit later in this presentation. The table to the right shows the percentage of disabilities per county served by Impact West Virginia, along with the NAS or neonatal abstinence syndrome rate for West Virginia counties. The table shows that Harrison County is #1 in disability and NAS, and #2 in disability is Taylor County, while Marion County is 2nd for NAS. Next slide, please. So as we take a deeper look at West Virginia, we note within a county, a higher proportion of people reporting a disability is sometimes associated with higher number of overdose deaths. The proportion for this chart on the right shows the proportion of people with a disability measured using the American Community Service Survey, ACS. And these surveys ask respondents if they experience the following: deaf or serious difficulty hearing, blindness or serious difficulty seeing, serious difficulty concentrating, remembering, making decisions, walking or climbing stairs, dressing or bathing, or doing errands alone. If people responded to one or more of these questions, they were considered on this survey to have a disability. And in some areas, as many as 1 in 3 people reported this type of disability. The dark red on the map here of West Virginia showing the counties is the most vulnerable, and the dark green shows the least vulnerable counties. So now we want to talk a little bit about the substance use disorder waiver in West Virginia. And in October of 2017, this was awarded to the DHHR to improve care and health outcomes. And this was done through expanding services to those with the substance use disorder diagnoses. The link here on our slide can take you to additional information, and there's also a number there for you to call in order to receive additional information. So the substance use disorder waivers were implemented in 2 phases. And the first phase began in 2018. And this began with the screening, brief intervention and referral to treatment, or the SBIRT, as we mentioned earlier, as an impact learning course. And this was implemented statewide to identify substance use disorder treatment needs among the Medicaid population. Also in phase 1, there was the naloxone distribution initiative that was to make naloxone widely available and increase awareness of the benefits of this in reversing the effects of overdose. The MAT, or methadone treatment and administration, added Medicaid coverage as a withdrawal management strategy, as well as the administration and monitoring of the medication and related counseling services. Phase 2 began later in July of 2018, and this included adult residential treatment. So Medicaid coverage of this treatment, adhering to the ASAM, or American Society of Addiction Medicine. There are comprehensive programs here for adults ages 18 and over who have the diagnosis of substance abuse or co-occurring substance abuse and mental health disorders. Along with phase 2, there were peer recovery support services implemented to be delivered by trained and certified specialists who have been successful in their own recovery process. And we also use these as a piece of Impact West Virginia. The withdrawal management services were also added, and they offer coverage of withdrawal management services through West Virginia Medicaid. It provides short-term medical service and managing withdrawal and facilitating access to the treatment as needed. We also want to look here at other waiver information and programs that we connect to here within the CED. So for example, we have the Work Incentives Planning and Assistance Program waivers, which is called WIPA. And this works to allow individuals to work and keep waivers if they are eligible. So this means that some participants are eligible for more than one waiver, and the WIPA program helps them navigate this process and to be able to see which ones can be used in conjunction with one another, and also to see if they can work and still keep waivers. Now, this waiver information can be different across states, and additional information on the West Virginia programs can be found with the link here on the slide. So as we're wrapping up, we want to talk about, so why should we care about this relationship between substance use disorders and disabilities? Well, it is important that we be aware of individuals with disabilities and substance use disorder. As Dr. Cottrell noted earlier, sometimes we need to recognize and sort these conditions and comorbidities into different sections so that we are not only aware, but then we can treat these appropriately. So spreading awareness about this relationship can help prevent that stigma and judgment, and sometimes the misdiagnoses that we may see. So a final thought, and this is taken from some of Aisha's wise words: when we are not okay, we do want support. And it's important to provide and receive adequate support systems within families, throughout providers, and throughout the communities that we rely on. Our slide here will show some resources and references that we've used for the presentation, and I believe these will all be available after the presentations. And we have one additional slide here that gives links to our Impact website learning portal, our Facebook, how you can make a referral to our program so that will show you the specific eligibility. an email for questions, and then some links to family and provider surveys that we use to identify topic areas of need that we may be able to help address throughout the community.
So at this time, if there are any questions, we would love to answer them.
And I see some notes in the chat. Thank you all for sharing. And those examples are specific examples of things we are exactly talking about, where, you know, the person that might have a disability was perceived to be acting in a certain way by maybe a police officer or a particular individual. And in reality, they were not. They were, you know, they were not using substances. It was just the way the particular person, you know, was and how they were perceived. So those are things we were talking about bringing an awareness to make sure that we're able to identify what is needed.
Aisha, I know that you and Sue had mentioned that there was a learning modules. Do you mind showing everyone where they can access those learning modules?
Sure, let me get those up.
And Sue, while she's doing that, there were a couple of questions that you may not be able to see in the chat. It says that what is the criteria for getting on the SUD waiver program? And also there was a question around Berkeley County and the highest NAS births.
Yes, and so we had a link to the dhr.westvirginia.gov that provides the waiver information for the substance use disorder waiver that would give you the eligibility and criteria for that one. And we noted that the highest county for the disability was Harrison, Taylor a second, and then for the NES was Harrison and Marion. And those were taken from the 9 counties that Impact serves. So that's not taking into consideration every county in West Virginia. That's based on the counties Impact serves. And here Aisha is showing the website for our online learning modules. And we do offer continuing education credits, and there are the list of topics there in gold are the ones that have already been launched. And then in blue are the ones that are coming soon. And thank you, Katrina, for sharing that link to the waiver program. And Michelle, I think that that's part of our topic of why we wanted to bring this up was, you know, noting how maybe the awareness and the treatment, being able to identify and separate these two, and maybe that's, you know, education for service providers or the community. And that's kind of what we want to talk about this a little bit today.
So I've shared the link for the Impact online learning modules and also the link to the fact sheet that we mentioned earlier on the drug addiction and federal disability right laws.
Yeah, this was a really interesting kind of a one-page fact sheet flyer that we found that kind of lumped a lot of this information into one place so that we were able to kind of sort it out and figure out what it all means. Yes, and thank you, Courtney. Happy to share the presentation to anyone that would like a copy.
Okay, well, thank you all for your presentation. It was so wonderful. I know this is a discussion that's not traditionally held around disabilities, but is so needed. So I hope we can continue this discussion. There is a link in the chat, and also Aisha just dropped the PowerPoint into the chat. So if you would like to grab it out of there, or you can email Sue directly. And I put her email in the chat. Oh, there's one more question in the chat for you, if you don't mind taking that before we head off. And if you can't see it, that question is, what are the projections for the number of West Virginia's children who will enter school with IDD due to their exposure to drugs?
I don't know those percentages at this time. I don't know if Dr. Cottrell is still on here and may have that number.
Yeah, unfortunately, I don't think we have a number that's directly linked to exposure in utero. You know, you talk to teachers, educators, and they said we've been seeing children come through and they make that connection, and many of us do in certain areas. But you know, this is where research connects to what's happening and gives us those numbers. We don't have a lot of long-term projects following the children who have an NAS diagnosis or were exposed to see what academic experiences or needs they might have as they get older. So hopefully we'll get that and we'll get accurate numbers.
Dr. Cottrell, I have a question regarding that. Do you all feel that the stigma that we have surrounding substance use hinders our ability to collect that data, and that people wanting to not self-report that they actually use substances?
I think that definitely is a factor. I think if we also look at models like fetal alcohol syndrome and things of that sort, that even when you do have the numbers, the long-term effects can vary greatly, which muddies the waters in terms of, so what does that mean? But we experienced the same kind of thing in the 80s with cocaine exposed babies, and now it's opioids. So I think we do have lessons learned, but that factor is definitely one. I agree with you, that goes into that. But it wouldn't stop research. I think the research is, you know, it takes a while to gather. So it lags behind a little bit.
Thank you so much. Are there any other questions? Okay, well, we'll go ahead and let you go a little early, so you'll have a little bit more of a break in between sessions. We will be having starting at 12:45 until 2 o'clock a circle of support. So anyone who is an individual with a disability, a loved one or caregiver, would be strongly encouraged to attend that session if possible. So feel free to drop in. And then our next main session begins at 2 o'clock, which is I Have the Right to Vote with Gina Desmond and Zach Kelly. I hope to see you all there.